Have you ever felt an uncontrollable thirst even after drinking plenty of water? Have you noticed that your body constantly craves food, but even after eating, the hunger doesn't go away? Or maybe you've realized that small cuts and wounds take too long to heal. If you answered yes to some of these questions, it might be time to pay more attention to your health because these are signs that could indicate diabetes. Millions of people around the world live with this disease without even knowing it. The problem is that when diabetes is not controlled, it can cause serious health damage, affecting organs like the kidneys, eyes, and even the heart. But is there a cure for diabetes? And how can it be treated? In this video, you will understand exactly what diabetes is, how it affects the body, what the symptoms are, and which habits can help keep this condition under control. In addition, we will debunk some common myths and show you how diet and exercise can transform the lives of those living with this disease. Diabetes is a chronic disease that occurs when the body is unable to produce or use insulin efficiently. But what is insulin? Insulin is a hormone produced by the pancreas that regulates the amount of sugar in the blood. Sugar, or glucose, is one of the body's main sources of energy. When we eat, carbohydrates from food turn into glucose, which enters the bloodstream and needs to be transported into cells to be used as energy. This is where insulin comes in, acting as a key that unlocks the cells to allow glucose to enter. The problem arises when the body stops producing insulin or cannot use it properly. Without enough insulin, or if it doesn't function correctly, glucose accumulates in the blood, causing high sugar levels, which can lead to various health complications. This means that a person with diabetes may have glucose in their blood, but their body's cells still lack enough energy to function properly. There are different types of diabetes, with the main ones being type 1, type 2, and gestational diabetes. Type 1 diabetes usually appears in childhood or adolescence and is considered an autoimmune disease. This means that the person's immune system mistakenly attacks the pancreatic cells that produce insulin, preventing the body from having the hormone needed to control glucose. As a result, those with type 1 diabetes need to use insulin daily for life to keep their blood sugar levels under control. Type 2 diabetes is the most common and is directly linked to factors such as poor diet, sedentary lifestyle, and obesity. In this case, the body still produces insulin, but it is not used correctly. This phenomenon is known as insulin resistance. Over time, the pancreas produces less and less insulin, making blood glucose control more difficult. Type 2 diabetes can be prevented or controlled with lifestyle changes, such as adopting a balanced diet and engaging in regular physical activity. Gestational diabetes, on the other hand, occurs during pregnancy and is caused by hormonal changes that interfere with insulin function. Although many women can control the condition with diet and physical activity, in some cases, medication or insulin may be needed. It is important to remember that women who have had gestational diabetes have a higher risk of developing type 2 diabetes in the future. Diabetes symptoms can vary from person to person, but some classic signs indicate something might be wrong. Excessive thirst, frequent urination, constant hunger, extreme fatigue, blurred vision, unexplained weight loss, and slow wound healing are some of the most common symptoms. Additionally, many people with diabetes experience tingling in the hands and feet, which may indicate nerve damage caused by excess sugar in the blood. But what causes diabetes? In the case of type 1, the main cause is genetic and autoimmune. For type 2, Factors such as poor diet, excessive consumption of sugar and refined carbohydrates, lack of exercise, and obesity significantly increase the risk of developing the disease. Stress and lack of adequate sleep can also contribute to diabetes, as they affect the production of hormones that regulate blood sugar. Diabetes treatment varies according to the type and severity of the condition. For type 1 diabetes, daily insulin injections are essential since the body cannot produce the hormone. For type 2 diabetes, treatment may involve dietary changes, exercise, and, in some cases, medication to help control blood sugar levels. In both cases, regularly monitoring blood glucose is crucial to avoid complications. Diet plays a key role in diabetes management. Foods rich in fiber, such as vegetables, legumes, whole grains, and nuts, help maintain stable glucose levels. Lean proteins like chicken, fish, and eggs are also good options. Processed foods high in sugar and white flour should be avoided. This includes sodas, sweets, white bread, and pasta made with refined flour. In addition to diet, physical exercise is essential for people with diabetes. Regular physical activity helps lower blood sugar levels, improves insulin sensitivity, and contributes to weight control. Aerobic exercises like walking, running, and cycling are excellent choices. Strength training helps strengthen muscles and improve metabolism. Ideally, you should exercise for at least 30 minutes a day, 5 times a week. Many people believe that diabetes is caused solely by excessive sugar consumption, but this is a myth. While excessive sugar intake contributes to type 2 diabetes, other factors like genetics, a sedentary lifestyle, and obesity also play a significant role. Another common misconception is that diabetics cannot eat fruit. Some fruits indeed have a high glycemic index, such as ripe bananas and watermelon, but others, like apples and strawberries, can be consumed in moderation. Diabetes is a serious disease, but it can be controlled with proper care. With a balanced diet, regular physical activity, and medical follow-ups, it is possible to live a healthy life and prevent complications. If you have a family history of diabetes or experience any of the symptoms mentioned, consult a doctor and get tested to check your blood sugar levels. The earlier the diagnosis, the easier it will be to control the disease and avoid future problems. Now that you know everything about diabetes, share this video with your friends and family so that more people can access this important information. Don't forget to leave a like and subscribe to the channel to receive more content about health and well-being. See you in the next video.